Good morning. I'm Dr. Arthur G. Handel. I am a board-certified plastic and reconstructive surgeon specializing in aesthetic surgery or cosmetic surgery. I have been practicing in Boca Raton, Florida for the past 26 years, and today we are going to be performing a facial rejuvenation procedure on my lovely patient, Marcia. My approach to aesthetic surgery of the face is I look at it as a rejuvenation procedure. We are not trying to change anybody's face. We are trying to restore it back to its beauty of early times. So what we like to do is discuss with the patient what their complaints are, what their concerns are, and then once we do this, we review photographs from their youth and we try to get them to that initial facial structure which they had in their youth, and that's the real person. So what we don't want to do is operate in a way that you're really changing the patient and distorting their features, distorting their skin, changing their eyes, and actually essentially making them look like a different person. So through the years of refining this procedure, we have found that the best technique to restore a patient's face is to assess the patient properly and use all the techniques that I have developed over the years to give her what I feel is the most natural and long-lasting result. So traditionally, it's not just a matter of just tightening skin and the muscles. It's assessing the patient's face in detail, looking at all the detailed structures. It's a little bit like engineering. It's not just an artistry. You have to see what type of tissues the patient has, the type of skin they have, and how it'll react during and after surgery. So today, with this beautiful lady, Marcia, we are going to ask her what her issues are, and then I'll explain how we're going to correct them. Go ahead.
Okay, I would like a lift. My neck, my eyes, I would like lifted. The lines from my nose down to my mouth filled in. And I feel my face is sagging in certain areas that I think needs rejuvenating.
Okay. Well, Marcia is a beautiful 69-year-old woman who is in very good physical condition, and we asked her to bring some photographs. If you look at this photograph, I feel that the most important part of the face is the eyes. If you change the eyes dramatically, you're changing the patient's face as well as their expression. And that's why there are some negative reviews of cosmetic surgery, especially of the face, because they say the patient looks different. So what we are doing here is assessing her photograph, and you'll see that some people have hooded eyelids, like myself and Marcia, and some people have deep-set eyes. In my opinion, do not want to convert hooded lids to deep-set eyes unless the patient specifically wants that. So with Marcia, she has hooded lids, as she did in her earlier photographs. The only difference is that the brow has descended. So by the brow coming down, it gives the appearance that there's excess skin on the eyes, but the wrong operation, in my opinion, is to take skin. Brow lifts have always had a bad reputation because of the old-fashioned procedure where you make a large incision from one ear to the other and pull down the scalp. The problem with that is not only is it a more involved operation, but there is hair loss, the hairline goes back, and there could be long-term to permanent sensation problems. What we do with the endoscopic procedure is we make 3 tiny incisions in the hairline, just behind the hairline, and we go endoscopically or with a scope, and we do the same procedure without cutting any skin, and we thin out the muscles that are causing the frown lines. So after the procedure, she will not need Botox in that area. And then we raise the brow to its desired level, and we secure it in place with a dissolving device called an endotine. Now, I try to explain that to the patient that the endotine is basically like a little carpet tack that holds the scalp in that position. And after about 3 to 6 months, it'll dissolve, and there will be almost no signs that you had an operation in that area. The next thing I will do is address the eyes. Now, she has just a little bit of puffiness in her lower lids from slight amount of excess fat, which has leaked through the eye structures. Now, there are different procedures for eyelid surgery. What I will not do on her, because she doesn't have a lot of loose skin, I will not make an incision and elevate all the structures of the eye. You don't want to do that if you can avoid it, because it becomes a more complicated operation and more chance of the eyelid being pulled down like this. If she needed that operation, we perform preventive procedures such as canthopexy or suspensions to keep that eyelid from being pulled down. But in her case, we're taking the eyelid fat from behind the eyelid, called the transconjunctival approach, and we'll tighten up the skin with the CO2 laser. The next thing we'll do is we'll address the face. Now, the biggest issue that most patients complain about is the neck. Now, that problem is not just because of skin that's coming down, it's because of the muscles that are hanging down. So the proper way to do this is, after you elevate the skin, you must tighten up the muscles, and you also tighten up the muscles on the cheek and lift it up over the cheekbone. This gets rid of the jowling, most of the nasolabial folds, and the marionette lines. Once we do that, the next step is to properly pull back the face in the right direction and not show any signs of surgery. Now, the key thing is, the reason why patients look like they have a tight face or an over-pulled face is because the hairline is distorted. If you do that, it gives an unnatural appearance to the eyes, and the hairline goes back. That is a major problem with facelifts, and the way I prevent this is the incision is always made in the hairline and behind the ear, so that you will not distort the hairline at all, and when she decides to wear hair up in the future, you will not see any incisions. So that is what a key to having a natural look. I always explain to the patients, like putting back together any object, like a car. If you hang a door back even a few millimeters off, it looks odd to the eye if you're focusing on it. And the same goes for the face. So naturalness is paramount. The next thing we're going to do is restore volume to her face where it's missing. Now, overall, she has pretty decent volume, so we are not going to overcorrect on her. The only place I'll be putting a little bit of fat is in this area called the tear trough deformity, where there's a little bit of a hollowness in the eyes. And the jawline, you can see that over the years her chin has receded a little bit, and instead of using a chin implant, we'll use the fat grafting because it's her own tissue. I can use as much as I need to use, and the other thing that's great about it is that it has stem cells. So for all these reasons, you want to use fat grafting, and restoring the chin area will be a plus as far as getting her to look more like that person. And then finally, we might put a little bit of nasolabial folds in any areas, such as even the earlobes. Plump earlobes are a more youthful structure, and patients really appreciate it when their earrings even fit differently afterwards. Now, Marcia fortunately has pretty good skin. Most of my patients need full face laser after this procedure, but she has pretty good skin, and we won't be doing a full face laser on her, but we'll be doing a little bit on the lower eyelids just to tighten up that skin without cutting out the excess skin. So as far as the procedure is concerned, we're going to be performing it in our fully licensed outpatient surgery center, and we have excellent board certified anesthesiologists. After the surgery, she will be monitored in our recovery room with all the safety equipment that is necessary to get her through this safely, massaging devices for the legs, etc. And this evening she will be in our recovery area with our overnight nurse, who's skilled in post-operative care for these kind of patients, and she will be the only patient that she has to take care of. And believe it or not, she won't be having any pain from this procedure. The brow lift gives you a little bit of a headache, sometimes a little bit of soreness for the first day or two, but the facelift is actually numb, and the numbness will be from the cheeks out to the ears and the whole neck. Within 3 weeks, that'll start coming back, and the healing process for the face takes essentially 6 months to a year to see the final result, but within, I would say, a week to 10 days, Marsha could feel comfortable getting out of the house. By 2 weeks, she could probably be going out to a restaurant or to a movie. And by 3 to 4 weeks, she could most likely be ready to go to a social event. And every week after that, she'll get better and better and better. It's basically fine-tuning. So I think that she's going to get a fantastic result, and we're looking forward to getting her through this procedure today, and we'll be following up with you on the post-op. Thank you.